Dr. Bob Gill, welcome, as always, to the mother of all talk shows. Why next week, Bob? What's happening then?
Thank you for having me on, George. So next week, we have a health and care bill, which is coming back to Parliament for its third reading. And, we've had conversations before about the stealth privatisation. Well, what this bill will do, it completes the legislative hurdles to allow a full-scale US corporate takeover of the NHS by replicating structures similar to the managed care model in America, whereby public budgets will be given over to the control of predominantly one insurance company, United Health, and their subsidiary Optum. So the NHS becomes just like a brand, a logo, which hands over a budget to private corporations, and over time, more or less all provision of NHS services will be done by the private sector. So you just have a budget and a logo. And that will replicate what they have in the States, where they do have public funding for some healthcare for those people not insured by the private system, and they have something called Medicare. Medicare Advantage, which has increasingly been taken over by the insurance giants. That's what we will be replicating in this country next week, George.
Now, how come virtually nobody knows anything about that? What you describe is almost a fate worse than death for the National Health Service. And do we not have an opposition in Parliament? Do we not have journalists in Britain anymore?
Well, the opposition, I listened very closely to Keir Starmer during the Labour Party conference and John Ashworth. None of them alluded to the threat within this bill. In fact, Labour Party policy has been to go along with the American takeover of the NHS for a brief period under Corbyn's leadership. There was some talk about the threat, some talk about Donald Trump's trade deal taking control over aspects of the NHS, but they never really used the ammunition that they had at their disposal. And the current Labour Party opposition is totally on board with the NHS going this way. Unfortunately, our media, the legacy media, is totally co-opted with the government. For the BBC, for example, their key positions are appointed by government. The mainstream print media is on board with the privatisation. Even the liberal press, like The Guardian, expresses some concerns, but say, well, this might be an improvement. They sing the praises of the former president for global expansion from United Health, who took over the NHS from 2014, Simon Stevens. They praise him as some neutral saviour for the NHS. But in fact, he spent the last 7 years preparing the way for this current legislative lock-in. A lot of the work has already been done, I'm afraid. These companies have been operating the NHS behind the scenes for at least 15 years. They started under New Labour. They've continued through the coalition, and now it's on steroids, using the pandemic as a perfect opportunity. In fact, so cynically and manipulatively disguising these changes that they had pre-planned as some response to the pandemic. You couldn't make it up, George.
Now, the last time I looked, almost everyone that works in the National Health Service is a member of a trade union. But I haven't heard from them either. Why so?
It's pretty shocking, George. There is a document which was signed up to by the health unions called the Social Partnership Forum in the mid-2000s, when Patricia Hewitt was the Secretary of State for Health under New Labour. They more or less agreed to not fight the changes. And, this is how we've ended up in this situation where the health unions, and, I hold my union up to be one of the worst offenders, the British Medical Association, have done nothing other than lip service just to keep the troops from rebelling. They've done nothing to halt the privatisation. In fact, there was a perfect opportunity in 2016 when the junior doctors woke up to the threat and attack on their contracts, and clearly that would have an impact on patient care, like we're seeing now with 40,000 nurse vacancies and 10,000 doctor vacancies. Well, they attacked the contracts, and now the NHS has been made safe. But what did the BMA do? Our union sabotaged their own industrial action, dissipated any fight back, and divided the troops, and the rest is history.
It's a bit like the fall of the Soviet Union to me. Nobody fired a shot in its defence and it died with a whimper. Is that the fate of the NHS next week?
Well, I'm doing all my I can to try and raise awareness. There are growing numbers of the general public who are becoming aware. No thanks to mainstream media, of course, and no thanks to the opposition. But we can't just sit back and let this happen. It may be that this legislation goes through and then the momentum builds for a fight back. That's what I'm hoping will happen. But the key problem is most people haven't got a clue what is afoot. The lies that we heard about going to war in foreign countries, the same lies are being peddled about the NHS, that it's not being privatized, and they will lie all the way to the bank, because what we have successive governments serving the interests of foreign corporations.
So you say that this week in the Health and Care Bill, which predictably has not much good for health about it, and perhaps even less good for social care, which is another area of total crisis that is going to cost the Tories votes in certain demographics of that, I'm sure. But the Health and Care Bill, anti-health, anti-care bill, when it goes through, you say that will remove the final hurdle to full-scale Americanization of the NHS. That's not quite the same thing as it actually happening. There's still scope for forcing the government not to proceed down that road, isn't there?
I think it gets difficult once the legislation is through, but you never give up hope. Maybe we need a poll tax moment where there's a significant grassroots rebellion against what they're doing. That's what we need. But next week, potentially, the bill will break up the NHS into 42 what they're calling integrated care systems, all with their own budget and all allowed to make a profit through the denial of care. The business model is denial of care. And, the health unions should be up in arms, because what will also happen is you destroy national bargaining for terms and conditions. And you'll have a deregulation element to the bill, which will allow non-qualified people to be delivering healthcare. You couldn't make up how catastrophic this would be to the general public and to the staff, yet there's next to zero awareness.
And therefore, no Tory rebellion, and they've got an 80-seat majority. It's going through, isn't it?
Well, there has been pressure. I've been helping a group called Your NHS Needs You. We've had a petition up, a parliamentary petition, which has exceeded the 100,000 signatories that it needs to be considered in Parliament. There's been a letter writing campaign directed at not only the Tory MPs, but also the opposition for not providing any opposition. So we have put all the pressure we can, but without the mainstream media reporting what they need to be reporting in a democracy, it's a tough battle, but we can't give up, George.
Dr. Bob Gill, you'll never give up. Thank you very much indeed for joining us